what we're doing here today. It is Our topic is COVID-19 and the exposure of America's long history with inequality. That's our topic. And as I said, we have Denise, who's part of the healthcare profession, that will be speaking with us, and we're going to be talking about what we're seeing across the nation. Myself, I am based in New York City, the Bronx specifically, and the Bronx has a long history. Oh, here comes Denise. Joining in just a second. Hi.
Hi.
How are you? Good morning.
Good morning. How are you?
I'm doing well. So I was just letting our viewers know our topic today is COVID-19 and the exposure of America's long history of inequality. So I kind of let them know who you were, but please introduce yourself. Tell our viewers about the work that you do.
Okay. Hi everyone. First of all, my prayers go out to you and your families and your communities during this time. My name is Denise Octavia Smith, and I am the founding executive director of the National Association of Community Health Workers. I am a community health worker, and I hope we get to talk more about that. And perhaps many of you, and I've worked as a CHW for about 15 years here. I'm also a mom of 4. I have 3 young men who I'm watching closely during this pandemic, and a 10-year-old daughter. My husband is a first responder, so we're in the throes of this on many different levels. I am grateful to have this opportunity because in my first life, I was also an artist, and I still am. I'm a theater artist and a musician. So the power of our languages to reach and transform community, to heal and to confront power is a legacy that we carry. It's a burden and a responsibility. And so I'm just thrilled to be part of the community today. Thank you so much for having me.
Thank you so much for being on. Thank you and your husband for being on the front lines all the time, not just during COVID-19, but all the time. For our viewers, where folks can find you on Instagram.
Yeah, well, D Smith NACHW, NACHW on Instagram. I'm showing my age, so I'm really more on LinkedIn, and you can find us on Facebook too.
Thank you. So I want to introduce myself. My name is Courtney. I go by Karis LeVay because I'm also an artist, but I'm also a community organizer here in the Bronx. I work with an organization called Citizen Action of New York. We are a grassroots organization. We are a C4 organization, which means that we lobby and we push legislation that we feel fits our worldview on how it can better serve our New Yorkers, legislatively wise. And I'm also part of another organization called Justice League NYC. And we are like a task force. We come out and we're like a task force organization. My art background, I am a Grammy nominated ghostwriter, songwriter. And there's this intersection of course, social activism and art. One of my mentors, with Mr. Harry Belafonte, says that artists are the gatekeepers of truth, and it is our duty to use our platform to not just put out great art that makes people feel good, but also people use art to see things that they may not be, things that are happening in the world. And so artists all the time, through music, through song, through theater, through poetry, use those platforms to talk about what's happening in the world. And I'm so glad to be doing this discussion with you. Folks can find me on Instagram and Facebook and Twitter at Keris, KerisLove, on all social media platforms, and my organization, Citizen Action NY, on Instagram, Facebook, and Twitter. So we're going to just jump right in. I've got a couple of questions. I'm going to take a couple of questions from the folks that are watching as well. But can you update us on what you're hearing in your prospective networks as far as um, folks being able to get tested, recovery of people, the differences maybe between even zip codes of some people who can get a test easily, maybe those who have been turned away. What are folks really experiencing like on the ground on what on being in this quarantine type life? Okay, just a slight technical difficulties, Denise. Let's see, or hopefully that's not on my end. All right, folks. Everyone's using technology these days. And it seems like we might be having have lost Denise a little. Okay, connection issues. All right, Denise let us know that we had that. We will get her back in just a moment. Okay, we're back on business. All right, we're back.
Yeah, I heard your question, but then it froze.
Okay.
So I mentioned that I'm a community health worker and I represent CHWs around the country. Let me tell you what that means. Community health workers are frontline public health workers. You know them. You see them in every community, in every demographic, across every culture, and across every sector. CHWs are working through your public health departments on diabetes self-management, heart disease and stroke prevention, colorectal cancer screening. So you're seeing them at the state level. They're working with moms and fetal and infant mortality. They're working in HIV/AIDS as peer advocates. They're working as community organizers, right, to address issues like immigration or housing. They're working in the reentry community as peers or helping people to find meaningful employment and to develop themselves in the workforce. You find them in our schools as parent liaisons and parent advocates, right? So CHWs are everywhere, and we are people who sign up for this work. Right? It's not that we go to college and we decide we're going to be a community health worker. There is a draw and a compassion that comes out of us to build bridges in our community, from health and social service systems deep into community, to make sure that we can draw down resources and information so that we can build advocacy skills, right? And so that we can promote social justice and equity through the work that we do, whether it's research, direct intervention, or prevention. I want to level set because over the past 45 days, we've been hearing from our membership. We have members in 40 states across the country. These are people working on tribal nations. These are folks working in urban and rural communities. These are folks working across sector. And I'm going to tell you some of what we've been hearing. And I just want to hit some high points. As we are hearing this widespread language about reopening states and reopening our nation, at the very same time, and we're hearing people saying it looks like we're flattening the curve. I want to tell you that communities that have experienced historic and persistent marginalization, and inequity, right? And equity is about what we can actually change. When I say inequity, it's something that we can actually change. Housing inequity, people being redlined and not being able to afford loans or gain access to affordable housing, that's something we can change, right? Having prevention, education, and having literacy, being able to navigate complex systems, that's something we can change. And so the persistent inequity that we're seeing among communities of color who are homeless, communities of color who are undocumented, communities of color with limited English proficiency, communities of color who are uninsured, communities of color with underlying health conditions. We're seeing incredible rates of a rise in infection and death. At the same time, people are saying, looks like we're headed in the right direction. That's the wrong language. Our community health workers are on the ground right now trying to help not only those people that we know have always experienced this marginalization and racism through structures and systems, but also all of the people who are newly uninsured, right? The business owner, the shopkeeper, the barber shop and the salon owner, the lawyer, right? All of these people who have never had a problem with persistent issues with access to what we call the social determinants of health, right? Food, housing, transportation, primary care, okay? All of a sudden, we have millions of people who are unemployed who now are standing in food pantry lines, okay? Who are now trying to gain access to Medicaid because they've lost their insurance and they can't afford COBRA or other private insurance. So we have lots of challenges right now on the ground. I want to tell you that as people are talking about all of the testing sites, the drive-through testing sites, the thousands that they've stood up across the country, that works great if you have a car. For people who don't have a vehicle, it does not work. All that you hear about the innovations in telehealth, right? That we can do this remotely. Your doctor can call you and can reach you over Google Hangout or Facebook Live or whatever that is. That's fantastic if you have a phone with unlimited minutes, if you have internet access, if you have a smartphone or a computer at home, and if you have the technology literacy. So for many people, this is not working, right? For everyone, it's not working because we have over 45,000 deaths right now. And we're reaching close to 1 million infections and states are opening. But I also want to lift up right now the really stark and kind of missing voices that we're hearing in our Asian American, Native Hawaiian, and Pacific Islander communities. These are communities that are not only experiencing all the challenges that I just talked about, but are also experiencing increasing rates of racism and violence because they are Asian or Asian presenting. And we've heard language coming from our White House of this being a Chinese virus, right? So I've heard, So I've heard people being denied access to grocery stores. We've heard of people being stabbed in Texas, right? So now people are afraid to even seek the services that they need because of the climate of racism, stigma, and blame that has now come with COVID-19 at the very time when we need to be coming together and promoting images and language of love and togetherness and service, compassion. We are hearing the opposite. The last thing that I have to lift up, because this is another missing voice, is the voices of our tribal nations. If you don't know that tribal nations have always experienced inequity in housing, access to clean water, access to food, access to medical care, this has been a given for hundreds of years, okay? The language of infection was triggering for lots of nations because we remember that many nations were conquered largely due to viruses that came from other lands here, and immune systems did not have the capacity to respond. But right now in Arizona, in the Navajo Nation, the rates of infection are 10 times what they are in the state of Arizona. In Utah, where there's another Navajo Nation, those rates are multiple times higher than they are in the state. So we've got to lift up and center our voices. And as we started out saying, the voices and the power of our artists are critical in this time.
Absolutely. Oh, you just gave us a whole word right there, Denise. A whole word. And so many communities that are not being lifted up. Also, as you were speaking and lifting up all these different communities, talking about really the root of the issue, something that I noticed, that as an African-American woman descended from slaves who built this nation, there's a lot of talk about personal responsibility. If you should just stay home, you should just eat right, you should just do those things. And I immediately thought about my kinfolk in Flint, Michigan, where the water is not, water has been an issue. Clean water, which should be a right for everyone, has been an issue. And there's so many Flints, where you lifted up the Navajo Nations, and these communities are not being spoken of. We're not hearing about these communities, and it almost feels as if, once again, we're okay with risking those communities just to get the economy up and back running, right? And so COVID-19 has really exposed what so many of our communities have already been dealing with: not having access to healthcare, food deserts, not having access to clean water. Our communities, I live in the Bronx right now, and we have one of the highest asthma rates. And so environmental injustice plays a part on when you're talking about, oh, there's a study that came out, Black and Latino people in the Bronx, the reason why you're now the epicenter is because you have asthma and you have poor health. But they didn't talk about the redlining that happened in the Bronx. And you didn't talk about the pollution and the things that are happening in the Bronx, or the infestation of our buildings, that these NACHW project developments that have been neglected for decades, which is why we have these underlying health conditions. And no one is speaking about those things. And I wonder, I guess for me, the question is, if we have folks like you in these networks who are saying, wait a minute, here are the underlying reasons. Why is our government not leading with that? You can't talk about diabetes and high blood pressure if you're not going to talk about food deserts, and if you're not going to talk about the systemic racism. So why do you think we're having these one-sided personal responsibility conversations?
Yeah, well, that's a huge issue. I want to make a couple points on that. The first is that we really have a culture in this country of individual responsibility, right? If me and mine are okay, then you obviously are not working hard enough. You didn't do all that you could. I just put in more work, or whatever it is. We know that is a false reality. We know how this country came to be. We know that it was built on genocide. We know that it was built on pain, right? We know that it was built with the bodies of people of color contributing their excellence, their time, their sweat, their very lives. Right? When we think about the greatness of this country, we have to think about the diversity of the people who are here, and the First Nations who have so graciously allowed us to come and be kind of all that we can be. But we have this sense of individual responsibility. Now, the issue of government responsibility is challenging because we know, number one, it's very difficult to get the voices of people on the ground heard. It takes coordinated collaboration, consistent action. And in many instances, our communities are not working in solidarity. right? We have found times now. I want to lift this up. We have to lift up the models that we have. We have models of people working across demographics, right? The Black Panthers, the American Indian movement,
Yes.
right? We have the white patriots, right? We have instances where we were working, the brown berets, where folks were working on social drivers of well-being and politics, okay? But at the same time that they were trying to hold governments to account, seeking public office or voting folks in, they were also using the assets of the community. And this is something that we have to do. You know, I've heard lots of folks say, ain't nobody gonna rescue us, right? The language is telling us that they are not going to rescue us.
Right.
We see that the great example are these small business loans that came through the last stimulus package. Before brown people could even begin to fill out the forms, the money was drying up. There's a new stimulus package that was just passed yesterday or early this morning, almost $500 billion. But we have difficulty accessing these systems, having the documentation, validating our businesses, justifying our requests. There is a language and continuous barriers for us so that we can actually have equity in these systems. So voting is key. I mean, we could go on all day about that. I know how people feel. I felt it the same way. Why am I voting? Who is representing my voice? No, you put someone in and demand your voice be heard. You're using this person's position as your avenue for your voice. That means you have to stay engaged beyond the vote. The census is another issue. Isn't it strange that right now, when we're allocating billions of dollars, the census.
Oh, wait, we had a little connection. Okay, yep, we got you
There
back.
are instances where millions of people have not even completed the census. But we know at the end of the day, this is going to dictate where our tax dollars go. So it's going to take a coordinated effort for all of us to keep track of what's happening at the federal level, to keep track of what's happening at the level of our state. And I want everyone to pay close attention to what's happening at your state level. What is your Department of Public Health doing? What is your local health department doing right now? We've heard lots of initiatives about contact tracing and reaching deep into community. Are they hiring people who are from the community? Are they hiring community health workers that you have seen consistently providing services and reentry, community violence prevention, working with mothers, working with the homeless? These are folks who are trusted in the community.
Yes.
These are the folks that we want calling us, knocking on our doors, providing education. It's good for our local economies because community health workers live in the same community where they work. So those millions of dollars that are going to come into your state health department for contact tracing and care coordination, you have to demand that those dollars go to people in your community, that they hire from the community, and that they're building on community assets. You mentioned your own organization, right? Your advocacy and organizing organization. You're an anchor institution for the community. Those dollars need to come to organizations like yours, to mutual aid organizations. There's a great one in South Florida that is stood up right now for LGBTQ, homeless youth, and other people who are experiencing real disparity right now. We've got to demand that those funds, which, oh, by the way, are our tax dollars, that they come back to us and that they serve our agenda.
Absolutely. A couple of things that you mentioned. I just wanted to lift up something that with all these stimulus packages coming out, you lifted up how I know people who have small businesses, and yes, by the time they got their things together, the monies were dried up. But it also said something to me. We always had the money to you already know where I'm going. We always had the money to fix our equity problem.
Oh, wow.
We always had the money, right? And
Sis, it's
so,
crazy. It's
yeah.
crazy. They literally started printing money.
And I know I think my mom is on here. She's always like, just print the money. My grandmother, who is a former Black Panther, and she's still an activist. She works for the with the National Action Network. And she's like, oh, we could have gotten reparations a long time ago. Like, we always had it. We always had it. These treaty deals that then they reneged on for our indigenous people. There's no need for the folks who built this to have these equity problems. So now we see it was always there. We could have, yes, Tanzania Huey says, cut the check. Tanzania Huey's an actor and a director here in New York City. Yes, they've always could have cut the check. And now we're realizing that. And it's true. When you brought up the movement, when you said Black Panthers, I immediately thought of the Young Lords as well. When we come together and get what we need for our communities, we have to demand them. And that is something that I see there's a lot of organizers on this call. I saw Amy, she's out in the capital of New York in Albany, Stevie's in Rochester. They done had a bunch of cuts to education and layoffs with teachers, mostly teachers of color, when they didn't even have that many to begin with. So I see a lot of my activist friends and organizers on here who are on the ground, who live in the communities that they organize in. And you brought up trust. And that's something that I see a lot in my community. I live in the Bronx. It's heavily Latinx, but there's this huge Bengali population that's growing. There's a huge West African population that's growing. And when I think about my people, trust is a factor. So if you come knocking at my door and you don't look like me, you don't speak like me, and already you're coming with the idea that I need you. Yes. Like, you need to save me. They're not opening the door. Yes. That's not opening the door. We talk about mutual aid, which is, I bring up my grandmother because I come from an intergenerational background of activists. And in February, my Nana was buying up things. She felt like she knew it was coming. Listen to the elders. She bought all these things and gave out alcohol to her neighbors on her floor. Was giving out things. And so about a week ago, I'm like, oh, Nana, you've been doing mutual aid. And she said, mutual what? Stop coming to me with those fancy terms. Stop coming with this is what we do. She's a Black woman who's from Harlem, originally by way of the South. This is just what we do. Don't come to me with these fancy terms, and now people are doing these things. Like, we've always done this. Yes. And she reminded me, she said, you need to know our people have always done this. We have always done sharing our food, sharing our supplies, sharing our home, sharing the child care load, all those things. We've always done those things. Stop coming to me with these fancy terms. And she's like, but I know you're in this work, so you probably have to use them. But that's something else. If we would just look to these communities, we'd have our answer. We have our answer on how to fix what is broken. And I don't, I see, how do we fix things in the wake of COVID-19? Well, you should be looking at your Black and Indigenous communities, because we've always been in a pandemic. Feels like this is not new. Lack of not getting food, being on the front line. So I want to kind of like transition us too, because as states are opening up, and we talked about personal responsibility, which we know is really irresponsible to do with not pairing the systemic piece, right? So as states are opening up, the luxury of remote work, we know is not available to many of our Black and communities of color.
That's right.
And so here in New York City, for example, our essential workers, we've got the people, the MTA who drive the train, the buses, our healthcare workers, we've got our janitors, we've got our nursing home people. In a past life, I worked a lot in foster care system. I used to run a group home. A lot of those residential facilities, juvenile detention facilities, correctional facilities, a lot of those front are grocery store workers. A lot of those are Black folks and people of color who are on the front line while states are closed. So now as we open up, how do they expect us to still be able to take personal responsibility and stay home when many of us are not part of the work from home luxury? And then if you rely, my boyfriend is a essential worker, and he has to ride the train from the Bronx to Tribeca every day. And if you live in these cities with transportation that we rely on, how are we supposed to flatten the curve or keep ourselves safe if we don't have access to jobs where we can work from home, savings? We expect poor folks to have 3 months savings, but we see these corporations within 2 to 3 weeks, they're asking the government for money. And so there's a big disconnect.
Yeah, there is. You know, the language about social distancing, self-isolation, if you're infected or if you're sick and you're at home, the language was very troubling on a lot of levels, right? For some people, the idea of isolating away from elders was just the wrong messaging, right? It just like that, like if that's the best that you can give us and you can't really give us anything else, how are we to care for our elders who are sick and isolate them? And we're all living in the same home or in the same apartment. The question about social distancing was challenging on way too many levels because we're frontline workers in every sector, people of color. Because we have less access to health insurance, we have less access to PPE. We know that even health providers working in hospitals are having challenges getting their PPE. So frontline workers are going to have difficulty. I'm not even going to go into the fact that the protocols for how people can continue to do their services safely is still not known by everybody. How do I do this correctly? How do I do this well? I'm doing a webinar next week with the Centers for Disease Control just to break down how can you actually wash your hands and if you have to reuse a mask, how do you do it safely? That's the level of individual responsibility. But we have to remember some people don't have masks and they don't have soap and they don't have hand sanitizer. Right? So let's put it into an equity context. If we want people to live, then we have to flip this and make sure we're reaching people who actually need all of these resources and benefits the most. Now, for folks who are going back to work, this is what is so problematic, because for people of color, we are less likely to have a job with sick time. We're less likely to have a job that carries insurance. So if let's say I'm not infected. Now, a lot of people don't even know. We know that you can have symptoms, right? And that kind of denotes your infection, or you can get tested and know that you're carrying the virus. But many people will not have symptoms, okay? But you will be a carrier of the virus and you can transmit it to others. So first of all, the call for people to go back to work, if I've never been tested, I don't have any symptoms, I could still be a carrier of the virus. So please do what you can to protect. If you have to go back to work, do what you can to protect your family coming home. Take your shoes off, my husband and I, we change our clothes as soon as we get in, take our shoes off, we put slippers. Don't bring in the takeout food bags. And we know that the virus can live on surfaces. Yes, we must do all that we can, even in that limited scope, when we're coming in and out of our homes, right?
Yeah.
If you have hand sanitizer, keep it right at your door. If you don't, you have the Lysol wipes or whatever you have, or immediately go to wash your hands. But these are limited in scope. If you've got to go back to work, if your job is not offering the appropriate protective equipment, then this becomes an OSHA issue. This becomes protection for you at work. This is a hazard for you at work. If you get sick while you're at work, you know, you've got to let your union know. You've got to let your HR department know. If you don't have an HR department, you got to seek a legal aid. Like, we really have to understand that for a lot of people, the COVID-19 testing is free, but the treatment, the care that you would get in a hospital is not free. And remember, they don't have an actual treatment. I want to be careful with my language. We don't have a treatment for this, a medication directly targeted toward it. But the care that you would receive, right, going on a respirator and getting some sort of assistance or pain medication or anti-inflammatory medication or whatever that care is, that will cost you. So we have to do all we can to prevent on the front end.
Yes, we have a question, and I just wanted to tell our audience that, yes, if you do have a question, please. So we have a question from BJB Free. What are your suggestions on highlighting representation in a community where Black and brown people are not the majority?
Oh, yeah. Okay.
That's a good one. Yeah, because they fly us under the radar when we are the majority. So if we're not the majority, do you have any suggestions for that? I think I'm going to think about.
Yeah. So at the state level, I would go to your Office of Equity. If you have an Office of Equity, I would go to your Commission on Women and Children. There might be an African American or Afro-Hispanic commission. Sometimes there's a commission for all folks of color. There are avenues that oftentimes we're not even aware of, offices and commissions that are available to us that we're not even aware of. So if you have those at your state level, you definitely want to engage those at your state level, because that's really important. If you don't have those offices and you really feel like the resources that are coming into your state or coming down through your health department are not being appropriately allocated, you might actually have to reach out to your Attorney General's office or your Civil Rights office, right?
Yes.
So most of those offices are at the state level. At your local health department level, it becomes challenging, right? There's a move right now for contact tracing. That means doing an epidemiological kind of approach to finding out who was infected and who might have infected others and collecting data and information. That can cause a lot of problems in your community, but it's also an opportunity to get on those advisories and learn who and how that's going to be done in your community right now. You have to develop coalition. I'm going to go back to this issue we said before. We have to work in solidarity. As an ethnicity, you might be a minority, okay, a numerical minority in your community. But there are also alliances that you can make with LGBTQ communities and advocacy groups. There are alliances that you can make with interfaith groups. There are alliances that you can make with other cultural organizations, if those are not already formed, because those are other numerical minorities perhaps in your community. So I would look to build solidarity. And I want to say this, I'll go back to the point you made about they could have just printed the money. Some of the changes, right, that folks are calling new and innovative and exciting, first of all, they're just equity. It's our tax dollars. You should have given them back to us in the first place. So that's a particular issue. But other issues like conversations about protecting people from eviction, okay? Conversations about letting elderly and folks who were nonviolent offenders out of jails and prisons. These are also things, people who are locked up just because they couldn't pay bail. These are things we also could have done a long time ago. So take this opportunity. We're not going to get everything achieved right now, but this is an opportunity now to build coalition, because we have to continue to push against these so-called innovations, right?
Yeah.
It's not just for now, it's for equity. It's for justice. Okay. And we can move some of those initiatives forward.
I'm I'm uh I am so glad you brought up the issues of like bail and incarceration here in New York State. Last year we had bail reform that was just, I mean, we changed the game, and it got
Yeah.
rolled back in this year's budget.
What?
Yes. And so I know folks are probably watching Governor Cuomo, and he looks like he's doing the greatest thing, but our state budget was atrocious. And the things that we want on bail reform have gotten rolled back.
Yeah.
Some of my advocates are on here. If you're on here, please drop the links and drop the talking points. But that was something that when we were fighting for it last year, it was because just equity. You should not have to sit, especially for low-level, nonviolent crimes. And if you think about it, this is pre-trial. So you haven't been convicted, right? So you haven't been convicted. So this is pre-trial. We should not be filling up our prisons, specifically during this time. We have the people working our prisons that are getting sick, and they're coming back and forth, and they're going back into the same community and bringing it back to their families, right? And so now in New York State, we are folks are tracking daily what's happening in our juvenile detention facilities and our prisons and our jails. But that our big win with bail reform was all about equity. It's not fair that you and I, because you have money, you can bail yourself out, but because I can't, so I can't bail myself out. And it's basically like saying, well, if you have money, you're less of a risk. If you're poor, we don't trust you on the street. So you get to stay in. And again, this comes back to, we know who that mostly impacted. Yeah. We know who that, and when judges have the discretion to look and see if you're dangerous, we already know what they're going to use when they're deciding who's dangerous and who's not. So I was really glad that you brought that up. That wasn't even part of our questions, but that's another community that we can't forget about, because in our prisons and our jails, our juvenile detention facilities are just going to be death pools of our people for no reason. Thank you for that. I want to just add, when you said for the communities, if you're not the majority, if you're not majority Black and brown, that yes, advocacy groups. So you might live in a town where people of color are the minority, but maybe the next city or next town over is a huge population, and of course they have plenty advocacy groups. And a lot of times, so with Citizen Action of New York, we have chapters all across the state. And New York State is real funny. You've got New York City, which is like this melting pot, and then you go further upstate, you think you're in the deep South. It's really strange like that. You're like, why are there Confederate flags in Buffalo? What's going on? This doesn't make sense. Yes. So yes, I would look over like really close to see where those advocacy groups are, because we're always looking to help our people wherever they are, even if you're the minority there. We've got another question from our gallery director, Nick. Can we speak more on housing and eviction? And I definitely can speak on housing and eviction. We do have a moratorium here in New York State where no one's getting evicted right now, but there is a campaign to push to freeze rents, because after the moratorium is lifted, we know we're going to have a slew of people into our housing courts. People are going to be months behind on rent. And so what is the relief going to be? There's also the issue of homelessness. In New York City, we've already had, we have the homeless problem is just out of control. It's grown 50% since 2010. So in the last decade, it's grown 50%. And so there is a push to house the homeless and vacant. That's another campaign, to house the homeless and vacant apartments. But afterwards, to allow them to not just to house them and then kick them out after COVID-19 or after the pause, but then how do we then transition them into permanent housing? Because we have vacant apartments here, pied-à-terres that are vacant. Rich people come in New York and they got all these apartments and they sit vacant, or developers build these luxury apartments
Yes.
in Bed-Stuy, Brooklyn, and South Bronx where no one can afford those rents, and they sit vacant while our people are on the streets or sleeping on the train. And so there's a push to flip that. There needs to be more affordable housing. When we look at the cost of living and the wages, they are not where they need to be at all. So many, even our essential workers, I'm looking at these essential workers and I'm like, they're so essential and they don't get paid a living wage. We have to fix that after this is down, but we definitely have to fix that after this is over. So here in New York
Wow,
State,
this is
yeah.
such a powerful. I love that you're breaking this down. I can't wait till I can spend time with you in person.
Yes.
Oh my goodness.
And we could talk about the art and the just everything, right?
But that's right. But this is why we need the whole ecosystem. Okay? We need the organizers.
Yes.
We need the community health workers. We need those working in behavioral health. We need those working in housing. We have got to come together because you're right. In my state of Connecticut, they've opened up or kind of commandeered lots of motels so that they can house people who are experiencing homelessness or have transient housing who are infected, right? Now, if it was that easy to take a vacant motel and flip it and turn it into housing, we know that for behavioral health advocates and behavioral health agencies, this is the #1 barrier for people managing their medications, managing their chronic disease is housing. So we have to find these allies while this is going on, right?
Yeah.
Because this is going to be going on for months. In other words, there's time. If you don't do it today, if you only email someone this week or next week, get on one of their Zoom meetings, it's going to take time to build. But we've got to create these networks. And the artists help to reveal this story. The artist can put this in your face in the way that no one else can. Because I'll tell you something, these millions of people who are experiencing unemployment right now, many of them, it's not that all of them are people of color, and that's not even the issue. These are people who were on the margins. They were living paycheck to paycheck. As soon as they became unemployed, they had a week, 2 weeks, 3 weeks, and that was it.
Yes.
This is a chance to build a momentum for equity.
Yes.
Now they see how much they need Medicaid, right? Because now they need health insurance. Now they understand how much they need affordable housing.
Yes.
Now they understand how difficult it is to access affordable, healthy food. So let's build our alliances as much as we can right now.
Oh, absolutely. We're not quite yet done. It looks like our time is remaining, but if we have to start the live again, please just come. Okay, we're back. We're back. Our conversation is not yet over. We're telling followers, yes, help. Thank you. Welcome back. Let's get people back on because we're not done with this conversation. Thank you all for coming back. We are not done with this conversation. We are gonna wrap up soon, but we want to make sure that you have some really great mutual aid organizations that are doing some things. So let me bring Denise right back. Thank you guys for joining us right back. We've got our numbers. Yeah, people came right back. There's these time limits on this IG Live. So thank you everybody for coming back. Folks are really digging this conversation. And I think part of this is, the conversation that you and I are having, Denise, is actually a conversation that I've had one-on-one with members of my community, with my friends that we talk about. And the feedback I've got is, why am I not seeing this when I'm clicking on the news? Why am I not seeing this with these, bigger celebrities and rich people who have these platforms that are doing these things? Why is this why are we being left out of the conversation? And this is why when I met Nick of the Art and Social Activism Project last year, I was down, because this intersection, this is so needed, and I can't wait to meet you after.